Hey, and y'all know CityCast covers a lot of local and lately even national politics. The candidate visits alone have been so intense. So if you need a small break from the real races, consider a new show from City Theater. It has a tongue-in-cheek name, I am quoting here. POTUS, or Behind Every Great Dumbass, are 7 women trying to keep him alive. It's running September 21st through October 13th, and they say it is perfect for fans of Saturday Night Live or Veep. Get your tickets at citytheatercompany.org and use code CityCast for $5 off your order. Today on CityCast Pittsburgh, the opioid crisis has rocked Western Pennsylvania, our friends, our neighbors, our families. Now, companies like Walmart, Johnson & Johnson, and others that made, sold, or distributed prescription painkillers have been ordered to pay $50 billion over 18 years to deal with all the damage. Pennsylvania is supposed to eventually get more than $1 billion of that, but how it's going to be spent and who exactly gets to decide, well, that is still being figured out. Today, we're talking about the latest, plus what you can do to get involved. It's Wednesday, September 18th. I'm Megan Harris, and here's what Pittsburgh's talking about. I'm with Ed Mahan, an investigative reporter at Spotlight PA. Welcome back, Ed.
Great to be here.
And Aneri Patani, a senior correspondent at KFF Health News, based in D.C., but honorary Pittsburgher today.
Thank you. Appreciate it.
So here in PA, we have received more than $200 million so far. Broadly speaking, what's this money supposed to go toward? Ed, we'll start with you.
I think it's worth looking back at how Josh Shapiro described the money back in 2021. He, as many of us know, is the governor now, but he was the attorney general at the time for Pennsylvania. He helped negotiate these settlements. And he talked about how these funds will be, quote, earmarked to offer and expand life-saving treatment options. But when you look at the actual settlement documents, the potential uses are much broader than that. The settlements describe opioid remediation, which it lists as address the misuse and abuse of opioid products, treat or mitigate opioid use or related disorders, and mitigate other alleged effects of the opioid epidemic. And as we all know, the opioid epidemic has had many, many effects. So there's been a lot of debate about what actually is allowed. There's a document called Exhibit E that provides examples of things that qualify. It's 15 pages long, that document, but it includes treatment, prevention, research, things like that. But it's not an exhaustive list.
Is there an exhaustive list anywhere, or is it just kind of up to folks' interpretation of this, bigger document?
I'd say it's largely up to interpretation. I think what Ed was saying of there's that term opioid remediation, but that can mean different things to different people. And until there's a little more legal guidance, and we don't know if that will come, it's kind of up to interpretation.
And there was something an advocate told me very early on. I was asking, these questions, and she said, it really comes down to how decision makers decide to wield their power. And so that's been a lot of the reporting since then, is who has the power and how are they using it?
Well, Aneri, I feel like this does speak directly to a lot of what you've reported on, which is the transparency piece. How open is Pennsylvania and its power brokers being about what they're doing, how they're spending this money, how they're thinking about spending the money? What's happening here in Pennsylvania? I guess, where do we fall on that spectrum nationally?
Yeah, so unfortunately, looking at this across the country, the level of transparency about, where this money is going, how it's being spent is honestly quite low. But I will say, amid this sort of low bar landscape, Pennsylvania is one of the better ones. So
that's shocking, generally speaking, that we're being more transparent about an issue, any issue ever.
Again, low bar here. Most of the states not doing so great, but there is reason for hope. So in Pennsylvania, local governments control 85% of the opioid settlement funds coming in, and most of those are required to report how they spend the money. They submit annual reports to this statewide trust that oversees the settlement funds. And this spring, the trust made public the list of ways that counties were spending that money. So that's the transparent part. There's also 15% in Pennsylvania that's controlled by the state legislature. And now what they're doing with that might end up in sort of budget documents or bills or like hundreds of pages of PDFs, but there's no specific requirement for it to be reported out in a way that would actually be accessible for like an average person to understand how the state is using that 15% portion.
And what hits me there is, you're saying annual reports. So whether it's that big local piece or the smaller state amount, either way, annual to me means that it's after the fact, after someone's spent all this money. And that kind of sucks for somebody who wants to have some influence before the checks are written.
And that's true across the country. A lot of places, and I mean, it's a logistical issue as well, right? How frequently can you ask places to report? So most places that have any reporting requirements, they tend to be annual. But the problem that you outlined is exactly what advocates and folks in the field are saying. Like, hey, if we don't like how the spending is going, or if we have additional ideas, we don't get to weigh in until the money's already been spent for the previous year.
Yeah. I mean, well, how is that working out on the ground then? Is there any mechanism for people to be able to make their recommendation in advance, I guess, wherever they fall in this, advocacy space?
I mean, I would say in Pennsylvania, you're seeing a very mixed approach in our 67 counties in terms of how they're engaging with the public.
Yeah.
You have counties that were pretty public about creating these committees that help create recommendations and had public meetings and a bunch of public listening sessions. And then you had other counties that, didn't do that, and they just folded it into their regular meetings. And you can file a lot of right to know requests and try and get a sense of how they're spending the money, but it is very challenging, because some of these meeting minutes might not specifically say that it's opioid settlement money. It's very challenging to get consistent information back.
I mean, can you name names here, like, counties that are doing it in a way that feels slightly more public versus ones that maybe aren't playing ball in the way that you would need to for, to do, robust reporting?
I mean, I would say the two that come to mind is Allegheny County has gotten credit elsewhere too, but they had that public dashboard early on that sort of broke down how they were spending the money. And that is very useful. You can then go and ask for details on the specifics of how they're spending the money.
Are they updating it? Because sometimes we post websites and then we don't actually do anything with them later.
I'll double check. I mean, I haven't looked at their website in a little while, but it was regularly updated the last time I was using it regularly.
I'm so proud of us.
And they got called. I mean, they got called out in like a national report that an area wrote about was like call to action. They mentioned Allegheny County. It was a bunch of nearly 200 groups across the country talking about good uses and bad uses of settlement money. And they talked about Allegheny County's dashboard, I believe, if I'm remembering this correctly. I know Delaware County had some public listening sessions that were like very proactive. But then there are other places that are relying on committees that aren't as transparent.
Well, so what happens then, when advocates and people directly affected by this crisis don't have that direct path to speaking with these decision makers, especially beforehand, like at a public meeting, for example? Are they finding other ways to weigh in, maybe?
When folks are not allowed to speak at public meetings, it's harder to find other avenues for them to weigh in because there's not a lot of access to these councils or the folks in charge of opioid settlement money in a lot of states. But I have seen advocates use the press, write letters to the editor, or try to get their story out there about what they want. And some are even, going so far. I've one person in particular comes to mind. There's a grandmother in Ohio. Her name is Jackie Lewis. I've been sort of in touch with her for a few years now, and she lost her son. He died of an overdose, and she's taking care of his daughter, so her granddaughter. And she really wants some of the settlement money to go towards families like hers, where grandparents are helping care for their grandkids, where there's a lot of trauma. And she has had a hard time reaching the board in Ohio that controls a lot of settlement money. So she and a bunch of others who kind of believe in this are working together to form their own nonprofit so that they can then apply for the funds to use it in the way that they want. But obviously that's a large lift for anyone to do.
What's up, guys? It's the champ, Sean O'Malley, here to talk to you about Prize Picks. Prize Picks is the best place to win real money while watching football. Run your game on Prize Picks.
PrizePicks will give you $50 instantly when you play your first $5 lineup. You don't even need to win to receive the $50 bonus. It's guaranteed. Just download the PrizePicks app and use code SPOTIFY. That's code SPOTIFY on PrizePicks to get $50 instantly when you play a $5 lineup. PrizePicks, run your game. Must be present in certain states. Visit prizepicks.com for restrictions and details.
This episode is brought to you by Vonage. Are you looking for a fast, affordable way to help your team work better together, even when they're apart? It's easier than you think. With Vonage Business Communications, your team gets a single application for voice, messaging, and video meetings that they can access from anywhere. Plus, it easily integrates with your CRM and other business applications to give your team the rich customer data they need to work smarter, not harder. Learn more at Vonage.com.
So people want to be more involved on the front end, but in the meantime, all of this money is getting spent. I'm wondering if people are happy with what it's being spent on. And also for folks like Jackie, the grandmother in Ohio who has now started a nonprofit, what are the odds that she's going to be successful, that she'll get this piece of the pie?
So I'll say in Jackie's case, we don't know yet. They've applied for the money. They haven't heard back. So stay tuned. And I'm staying tuned on that. I think overall, there are definitely places where people are happy with some of the spending. I think when I talk to folks in public health and policy and treatment, they kind of say, there are concerning examples of spending everywhere, but kind of similarly, there are good examples of spending most places too. So for example, in California and Texas, they're putting millions of dollars towards distributing naloxone, which is a medication that you can use to reverse an overdose, often known by the brand name Narcan, and training people to use that. Colorado has this very transparent dashboard and this collaborative process that different regions spend money together in a strategic way. And I know in Pennsylvania, a lot of the counties are using the settlement funds to provide better treatment for opioid use disorder in jails, which has some controversies, but I think on the whole is a very evidence-based treatment that a lot of people have been excited about.
I think it's also worth sort of just establishing the process. The counties spend this money and then they report to the trust, and then the trust is deciding whether they spent the funds appropriately or not.
The trust is at the state level too. It's the Pennsylvania Opioid Misuse and Addiction Abatement Trust. PA loves a long name.
Yeah, exactly.
Just rolls off the tongue.
Yeah.
Yeah, and there, it's made up of various people. There's 4 state lawmakers on it. There's regional representation for the counties. Allegheny County's executive gets to appoint someone. Philadelphia's mayor does. So there's a variety of how that power is distributed, but they have the power to decide whether they spend it appropriately or not. And I think what we've talked about a little bit is that what's appropriate under Exhibit E is not cut and dry. And so what we've seen a lot of debate about in Pennsylvania is a couple of things. There's been a lot of focus on law enforcement. And the trust in some ways has pushed back against policing and that kind of things. But we're also seeing that I reported on a story earlier this year with my colleague Danielle Ohl of Spotlight PA that 10 district attorney offices were entitled to more than $4.5 million in settlement money in the first few years of this being distributed, and they're entitled to more going forward. And they haven't had to report to the trust how they're spending that money. We've filed requests and gotten some information.
So that's money for prosecutors, but I'm not hearing money for public defenders.
That's been a concern of public defenders across the state. The ACLU of Pennsylvania cited that in a lawsuit earlier this year over Pennsylvania's public defense system. Basically the concern is that it's exacerbating inequities that already exist if the money is supporting prosecutor offices, but it's being denied to public defenders. We've also seen debate over money for county coroners. And we've heard from a number of advocates who are concerned that money for county coroners is going to help them investigate these cases. And they're going to use that to then help prosecutors prosecute drug delivery resulting in death cases.
And that charge, at least in this context, it's a pretty new addition to the PA Crimes Code for people, accused of contributing to someone's death by helping them acquire drugs, lethal doses of them, that sort of thing.
So that's been a concern as well. And then there's also just been questions about where they draw the line. The trust gave the green light to spending it for body scanners at county jails, but at the same time, they cut off public defenders, which was a move that didn't make sense to some of the people we talked to.
Yeah, I mean, is this some of that it shouldn't be a one or the other thing? I can imagine playing devil's advocate that prosecuting the people who are bringing drugs in, or at least attempting to, might feel cathartic in the moment for some people. But if you deny it to public defenders who would then, be trying to defend people who are being charged with drug crime, I can see how that would also be troubling to some. I mean, is that part of it? Like we're doing something for one, but we're not doing anything for the other?
Yeah, I mean that's the big concern is that you're supporting prosecutor offices but not supporting public defenders offices. And I've talked to plenty of people across the state who think you should spend money on prosecutors' offices, that Exhibit E should allow preventing misuse of opioids. And they're like, well, prosecutors, they prevent the misuse of opioids.
And by some people's definition, that would qualify as remediation. I think that speaks to your point about it just being a very broad word in this context.
Yeah, and so that is exactly, that's sort of the broader point that, like, I understand why they would make that case under Exhibit A.
Yeah, I mean, but at least all that money, whether you like where it's going or not, is local. An area I know you've also done a story about how corporations are benefiting from the settlements. How is that playing out?
Yeah, so I don't think this is going to be surprising to most people. Anytime there's a windfall of cash going to governments, a lot of businesses line up, right, hoping to get their piece. I think we are seeing this with the opioid settlements. One example I'll point to from Delaware County has to do with a company called doTERRA. And so that company makes pouches where you can basically put in prescription medications like opioid painkillers, and you add water and it deactivates the medications before you toss them in the trash. And the idea is basically you avoid misuse of, unused or old pills, and that could prevent addictions from starting. So Delaware County is using $1 million of its opioid settlement funds to buy those pouches and mail them to residents' homes, which I think the idea of prevention people support, but this has caused controversy because when you look at the FDA's website, it says you can safely flush unwanted opioid pills down the toilet.
That our modern water treatment facilities can clear that. It's not a problem.
Exactly. So the FDA says this is safe. This is a free intervention versus, the $1 million that's being spent. And even if it's not, harmful, I think the idea is there's not an unlimited pool of opioid settlement funds. The money that's coming is great. It's a huge amount, but it's not enough to solve the crisis. So every time that it is spent, it sort of needs to be strategic and be helpful. And so some advocates are looking at that $1 million in Delaware County and saying, is that really the best use?
Yeah. I mean, is there any recourse then? Could the state board then look at that and be like, this one doesn't pass muster. We're not doing this.
They could, but they did not.
They didn't. Yeah, right. They approved that, right? Yeah.
Well, so I guess let's zoom out a little bit. If remediation is the mandate, but saving lives is the overarching goal, what would we be spending this money on?
Yeah, so when I've posed sort of this question to researchers, folks working in public health, they generally tend to point to two things, at least in the short term. So the first one is harm reduction efforts. And this is just generally things that keep people alive, even if they're using drugs and continue to use drugs. So this is things like distributing naloxone, again, often known by the brand name Narcan, distributing sterile syringes so that people don't get or spread infectious diseases, things in that realm. The second thing people point to is low barrier treatment. So basically make it easy for people who want to stop using drugs to access treatment. Don't make it expensive. Don't make it, a lot of barriers with insurance, and make sure that the treatment that people are accessing is high quality and evidence-based. And what that means is generally offering people medications that can reduce cravings for opioids and making that easier for that process easier and sustainable for them.
I'm guessing from the way you say making it easier that it is not what you would call easy at present.
Definitely not. I have talked to, and I'm sure Ed has as well, so many parents and individuals and families who have tried to get treatment who are told, there are wait lists everywhere, or that they don't have the right insurance, or someone needs to have used drugs recently in order to be admitted, or needs to be not using drugs for X amount of time, or they have a mental health disorder, so we can't accept them at this addiction treatment facility, but then the mental health facility won't accept them because they have an addiction issue. There are just so many barriers right now.
Ed, do you know how much Pennsylvania is spending on some of these strategies right now? Is anyone even calculating that yet? Like percentages in this way, like how much goes to a corporation versus how much is going to harm reduction or whatever?
I don't have that yet, I will say.
Also, not yet from my end, but because that is sort of a question nationwide that like people have been interested in, myself included, of like what percentage is going to treatment or is going to harm reduction or et cetera. So I am actually I have a project in the works with the Johns Hopkins Bloomberg School of Public Health and a national nonprofit called Shatterproof, where we're trying to track this money across all 50 states. And we're hoping by the end of this year, we'll be able to answer a question like that.
That's incredible. I mean, are there states that are that transparent, that clear cut about how they're spending the money?
Yeah, there are definitely states out there that have greater transparency. I think generally on the national front, people point towards North Carolina and Colorado. Both of them have developed these dashboards that, it's a website you can go to and kind of click around and see county, state money, how are they spending it, how much is going to different efforts. I'll also mention Indiana, less like high tech, but they have a spreadsheet you can download that shows where every county and city is spending its opioid settlement funds. It's not real time, but it still shows you a lot more information than other states, where there are some states where you just can't figure out where this money is going at all.
So I guess I'm glad that Pennsylvania is not the worst of the bunch as it relates to transparency, and very proud of Allegheny County for having a dashboard. But I mean, can it get better? Like, Ed, as you talk about, our policymakers, like, could they adapt to these gold standard models, or are we just sort of stuck in our ways now?
I mean, I think it comes back to what the one advocate told me about how people in power, it's how they decide to wield their power. Aneri and I had a recent story about public comment policies, and Pennsylvania's trust doesn't allow the public to speak at their meetings. And, we've talked to a number of people who are, one, just frustrated. They feel like that makes it adversarial, but it also, they don't have a chance to raise questions, raise concerns about specific programs, or to raise questions or concerns in real time in a public manner about how the trust is using its own money for administrative expenses and for its own contracting purposes for its work as well.
So just as an example of a state that is pretty open with public attendance and comment, Tennessee is one where members of the public do regularly attend their meetings. And the chair of the council there is a doctor named Stephen Lloyd, and he's in recovery himself from addiction to opioid painkillers. And he basically talked about how his recovery journey, feedback and criticism were critical to his recovery journey. And so he kind of looks at this process the same way. So in June, someone came to the council meeting in Tennessee and criticized them for awarding fewer grants to Western Tennessee than the rest of the state. And Stephen Lloyd basically said, hey, we had to take that into consideration, and now it's changing the way the council is planning for its next round of grants.
I mean, is there anywhere that either of you would point people to, like if they are hearing this and they have a thought about how this money is being spent, where they should go, like where they should start?
I think in Pennsylvania, and Ed, you can correct me if I'm wrong, you should start at the local level, because the counties make the first decision. Like Ed said, the statewide trust gets to say if that county decision was correct or incorrect, allowable or not allowable. But it's starting at the county level. So maybe the county commissioner or the local drug and alcohol treatment SCA. So I think a lot of the decisions start locally.
Yeah, I mean, that's the biggest thing. If you can, reach out to the local people, because they do have a lot of power, and some of them are doing more formal ways of engaging with the public, and some of them aren't. And so if you put yourself out there to communicate with them, you can have an impact.
Well, Ed, Aneri, we will be following your reporting, especially that great big story that you're working on now. We appreciate you both so much, and we'll have links to lots of your stories in our show notes. Thank you both.
Thank you very much.
Thanks for having us.
That's all for today here on CityCast Pittsburgh. We looked it up after we hung up with Ed and Aneri. That dashboard that Allegheny County has that got so many flowers for how it tracks opioids and how they affect our community, it is being updated about every couple of weeks, and there is actually a lot of data represented there. So if you want to know more about how this is hitting our town, there's a lot there to look at. We'll be back tomorrow morning with more news from around the city. Talk to you soon. Looking at Tennessee as that example, are their meetings like spicy? Is that like, can they be a little bit more interesting because of that? Because you do have a more fluid back and forth?
Not sure if I'm going to have to go to ask Stephen Lloyd if he would use the term spicy. So stay tuned on that.